my name is Jill Berry Bowen, CEO of Northwestern Medical Center, and you're host of the NMC Health Beat Show, dedicated to discussing important healthcare topics of interest to our community. On today's show, I'm talking to Tyson Moulton, who is the Director of Facilities, about what's going on in the month of June with NMC's construction work. We just had a wonderful groundbreaking, and I think as soon as we put the shovel in that dirt pile, the equipment started moving in and really moving the real dirt. So, Tyson, thank you for being here.
Thanks for having me.
Yeah, there's a lot going on, and I'm so grateful that you're leading us through this major construction.
Oh, thank you.
Couldn't be happier to have you aboard at NMC. So maybe we should just ground everyone in what is the construction, what is the major pieces of the project. Maybe start with the Med-Surg ICU wing.
Sure. So there's three major phases to this project. The first is a Med-Surg ICU expansion and renovation, and that expands on our existing Med-Surg wing at the north side of the building and adds 20 new private patient rooms. And then we go back and we renovate the 14 existing rooms in the Med-Surg wing into new private rooms. So that's the first phase that we're starting to get into work on now. The second part is a medical clinics building, and that's an expansion that we'll see at the front of the campus, right next to the lobby. That portion will also include a renovation to the lobby. That'll be about 14,000 new square feet with room for cardiology, pulmonology, specialty clinics, and space for the OBGYN clinic to come into the main hospital building. The third portion of the project is a freestanding medical office building, and that'll be a two-story building to the east of where the medical clinics building and where the main entrance to the hospital is, and will include space for orthopedics, primary care, and urgent care on the first floor, and then the second floor will remain shell space for future expansion.
Right, it's a huge project.
Big project.
No, it's pretty amazing. So as you come onto the campus now, and you head out back, because you mentioned Med-Surg, they're trying to prep for that that expansion. So when you're going like to urgent care or primary care, you're trying to get to Cobblestone and Northwestern Occupational Health, what can folks expect, like, now in June, in regards to getting traffic to the back? Because we still want to provide services uninterrupted as best as we can.
Absolutely. So right now what we're working on is really the loop road that goes around the north side of the building comes fairly close to that Med-Surg, to the existing Med-Surg wing. And so we have to move that road out of the way. So we have to move it to the north. And that's really what we're working on right now. Is doing any utility system moves, stormwater, natural gas, any of those things, and then building that new loop road so that we can demolish the existing one and make room for the new building. So what we're seeing right now is a lot of activity on that north side. For the most part, we will keep traffic on the existing loop road until the new loop road is built, with some minor changes. There will be an alternate way to get to Cobblestone. Instead of, there's a right-hand turn that you take there that'll be a little bit further down. It'll be closer to kind of the maintenance barn, but there'll be signage to direct you, so you'll still be able to have access from the Crest Road and main entrance to Cobblestone. There's also going to be a period of time where we have a little diversion, but again, there'll be good signage about how to get where you're going. And the same basic path from Crest Road to Cobblestone will exist.
So how long is that disruption going to be towards the back of the campus, where you kind of have to look at the signage to get to Cobblestone?
We'll have about 2 weeks where we'll have a little detour. And then the total disruption back there will be into early July. So there'll be work going on around there, and then in early July we'll have that loop road completed, the new loop road, and then we'll be diverting traffic onto the new loop road.
Okay. Now, since you're pushing that road back, doesn't that interfere with parking? And
It does,
What's
yes.
that domino look like with parking?
Yeah, so parking does get impacted, mostly for employees though.
Okay.
In the back of campus,
right.
that the space where we're building the new loop road previously was second and third shift parking for our staff, as well as some additional employee parking. The benefit that we have here is last year when we did the Crest Road project, we overbuilt parking a little bit, knowing that we were going to cut down on parking during this project. So while parking is going to be tight for the next couple months, it never dips below the levels that we had before we did that Crest Road project.
Okay.
So visitor parking really doesn't change right now.
Okay. All right. What about the front entrance? Because I know we're going to be moving to the front. What's the timing on that, and what disruption is that going to cause?
Sure, yeah. I mean, the front entrance is really kind of the big show as far as disruption goes.
Yeah.
We are renovating the lobby, which means we're going to have to close the lobby for about a 4 to 5 month period. And then there's a lot of site work that has to go on at the front of the building to make way for the medical clinics building and then the medical office building. So starting in early July, we'll be closing down the main entrance, the lobby entrance to the hospital.
That's big.
That's big, as well as the most westerly entrance on Fairfield Street. So this is where all the ambulances come in, and it's the most direct route to the main entrance. We have to do a lot of grade work, so we have to close that down, as well as a lot of the visitor parking, right out front of the main entrance. So obviously a big disruption.
Yes.
The biggest being, where do you actually get into the building? So our temporary main entrance from early July into October is going to be through the conference center. Now the conference center is on Crest Road, so if you pull in on Crest Road and just keep going straight instead of pulling into one of those visitor parking lots on the left, right after the loading dock, you end up at the conference center. Now, as part of that Crest Road project, we built some parking there, so there will be some parking there. We also built a parking lot south of the doctor's office commons buildings, and so that's just to the east of Crest Road and to the north of Fairfield Street, and that will all be visitor parking as well.
Okay.
So as you come in, there'll be visitor parking on your right, and then you'll get to the conference center on your left. And that's going to be quite a disruption. We're going to be taking a lot of steps to make sure that wayfinding is clear, that people know where they're going. If that conference center parking lot is full, people know where to go to find parking.
Okay. So when I come into that education center, there'll be folks there greeting me?
That's correct.
Because it looks like I'm going to be coming in the other end of the building, so if I'm having surgery, I've got a longer way to go.
That's correct.
To get down there, and my waiting room is probably different and gone and all that stuff. So.
Yeah, that's I focused on the outside, but there's a lot of inside impacts as well. The benefits of entering through the conference center is adequate parking, handicap accessibility. The kind of downsides to it is it's a little bit further from services, so we recognize that and made sure that we have adequate volunteer staff at the conference center entrance, at the temporary entrance, to be able to get people to the services where they're going. Because even if people coming in are familiar with the hospital, they may not be familiar with the hospital from the conference center entrance.
That's right.
So
different orientation for sure.
Exactly. So we anticipate that we'll have a lot more wayfinding needs, and what we're gearing up for is to be able to actually have somebody at the main entrance who can say, let me take you there, whatever it is you're looking for. So yeah, that lobby renovation does displace a lot of other services as well, not just getting into the hospital. It also displaces registration, which will be moving just down the main corridor a little ways, right outside of the diagnostic imaging area. There are going to be booths, or there are currently booths on the hall there, so that you can register. Surgical waiting will be displaced, and it'll go into a room that we call the Champlain room. That'll be on that main hallway. The gift shop will be displaced, and they will be moving into an area near the switchboard, as well as outpatient lab and cardiology pulmonology.
Where am I going to find those things?
Yeah. So outpatient lab. So if you're coming in for blood work or anything like that, is currently right at the main entrance.
Yes.
We're going to be moving them into Doctor's Office Commons Suite 1. So as you're coming up Crest Road, those one-story brick buildings on your right-hand side, the first building you come to, and the first suite you see, that is Doctor's Office Commons 1, and that's where the outpatient lab will be located, and they will be moving on June 20th.
Okay.
So June 20th, they'll be in their new location. Now, cardiology pulmonology is going to be moving to Doctor's Office Commons Suite 10. So this is formerly Dr. Bellstrom's space in the northern building. So it'll be the second entrance to Doctor's Office Commons.
Okay.
And you'll take your right-hand turn in there, and I think it's the second or third suite on that side, and it'll be labeled, and you'll be able to find your way there.
Okay.
And they move on the 27th, June 27th. Okay. And they'll be moving.
All right, so there's a lot of dominoes going on. So maybe we should remind everybody, why are we doing this? Why are we turning the campus upside down? What's on the other side of this? And by the way, how long is the whole project?
Well, the whole project is about 18 months.
Okay.
The lobby renovations will be, which is really the most impactful time from a wayfinding and parking and all of that, will be about 4 to 5 months. And that'll be starting in July and ending sometime in October.
Okay.
So yeah, the whole project, 18 months, and at the other end,
there's light at the other end.
I'll start with the benefits, and you can fill in all the blanks. But at the end, we get private patient rooms for our community.
That's great.
Which is,
long awaited.
Long awaited. The right thing to do. Better for outcomes. Better for privacy, better for infection control, all of those things. We also bring primary care and urgent care to the front of campus. Right now, they're living in cobblestone at the back of campus. We love having them on campus, but they are really central to the healthcare that we're trying to provide, the preventative care, that outpatient care that is really key to creating a healthier population as well as reducing the cost of healthcare. And then also bringing some of our practices into the hospital. So OBGYN, so that those providers can be in the hospital proper, so that they can have easier access to patients that may be in FBC or trips to the ORs for C-sections. Same thing with orthopedics coming into the main hospital.
Great.
And then also providing expansion space for the future with the second floor of the medical office building. Did I miss anything?
No, I think you're right on. No, and that loop road, the campus flow, the parking, everything is going to, come together. So I think that's, if we can kind of see past this, we're really investing in our future. And so it's a little bit of chaos, but it's chaos that shows progress. And in the end, better care for our community. So, no, you nailed it for sure. So to sum this up, we're doing back. There's a little bit of a disruption getting to the back of the campus, but it's going to be well defined with wayfinding. So please continue to use the campus. Use that Crest Road as your main pipeline onto the campus.
That's right.
Because on or around July 1st, we're going to be moving the front entrance to the education center, where there's good parking, handicap parking, and we'll have additional parking because right by the Crest Road to the right, we prepared in advance for that. And then we're going to find lab draws in Doctor's Office Commons 1.
Yep.
And then we're going to find cardiology and pulmonology in Doctor's Office Commons 10, former Dr. Bellstrom's space.
That's right.
So we'll continue to have the same services, and we'll provide good communication to the community on a very regular basis to keep people informed of this. Is there anything in closing, because our time flew on this, we could talk for a long time, anything else that we should let folks know that's coming up?
I think that those are the main points for everyone to be aware of, and I think that we've tried to be very thoughtful in the way that we're phasing the project and that we're communicating the project. And if anybody has any issues, please contact us. Please contact someone and let us know, because if it was confusing to you, it's probably going to be confusing to someone else, and we want to be able to make those changes so that we can make this as smooth as possible, even though it is going to be a disruption.
Yeah, okay.
And also just for the community to keep in mind kind of the benefits of this project. It is going to be a little bit messy, but we get so much out of it.
Yeah, that's great. Well, thank you so much.
Thank you
Good
for having
luck
me.
with the project, and thanks for keeping us up to date. Appreciate it very much. This is Jill Berry Bowen, CEO of Northwestern Medical Center, and so grateful that you joined HealthBeat today, because there's so much going on in the hospital for construction. We want to keep you well informed. We want our care to be exceptional even throughout this, so hopefully you'll still come for your services at the hospital. And when you come, please thank the volunteers, because they're really the ones making this all work with helping us get to the right place during this time. So thank you.